My name's Karen Moss, and I'm the founder and executive director of the non-profit organization called Steps Charity, based in Cape Town.
Lovely to have you again, Karen. How are you doing today?
I'm actually doing very well. As you can see, the sun is shining in Cape Town today after a lot of rain.
Yes,
And so far, this is one of our important months of the year, celebrating clubfoot awareness, and I'm doing very well, thank you. And I hope you're well as well.
I'm good. Thank you for asking. So the 3rd of June was
Mm.
World Clubfoot Day. Can you just tell us a bit more about this significant day and what did Steps do to commemorate the day?
Absolutely. When we started World Clubfoot Day, it was way back in 2008, and it was quite a small event in those days. It's now become a global event, and it really was celebrated in many, many countries. I still seeing reports coming through of places in South America, Asia, all over Europe. It's really phenomenal how it's grown. And the reason that World Clubfoot Day is on the 3rd of June is that it marks the birthday of the person who invented or developed a method called the Ponseti method. His name was Dr. Ignacio Ponseti, and he was born on the 3rd of June in 1914. And he actually treated my son for clubfoot in 2003 when he was 89 years old, and he lived to the ripe old age of 95.
Wow.
And we honor him by celebrating Clubfoot Day on his birthday because he developed a method that is a non-invasive, almost sometimes involves a little bit of surgery, but far less invasive than the old way of treating clubfoot, which was very, very advanced, intricate surgery, and often resulted in people having arthritis when they grew up, or scar tissue and other issues, and even more surgeries.
Mm.
So this has been significant development, but unfortunately only reached children globally from the early 2000s. For 50 years, Dr. Ponseti was largely ignored. He was a Spanish immigrant living in the Midwest of America. He was a pediatric orthopedic surgeon working at an academic hospital, and he carried on developing his method and having these incredible results, and yet was largely ignored. And towards the late 20th century, early 2000s, parents started to hear about him because he had been told he should write a book. He'd been brought out of retirement and he was still treating kids at the clinic.
Mm.
And when parents started discovering who he was, they started to spread the word. And I luckily enough, found these parents after my son was born with clubfoot in 2003, and made contact with them, flew to Iowa, had him treated, and then asked him why did I have to come all the way here to have my son treated for clubfoot?
Yeah.
And he said, because the doctors don't listen. So you must go. You're a mother. Mothers know their children. And this is really how it all started. And World Clubfoot Day is really a message to the world that clubfoot is treatable. It doesn't have to be a disability. There is a way to treat it. It brings hope to children, especially children that are living in resource restricted settings, that've got to walk to school,
Yeah.
that need to wear shoes to get to school, and that type of thing. So the more it grows, the more children can get this treatment, and the more support we'll get, because clubfoot is a team. It's a team effort. It doesn't take one doctor to treat clubfoot. You need two people to manipulate the foot. It takes about 2 months to get to that stage of treatment. Then the parents take over, and they're wearing a little foot brace, which is called the maintenance phase, up until the child is 4. There are many people involved around that child to get that foot 100% right. So the child doesn't really go through any pain, but the commitment and passion that's involved in treating clubfoot is really what is so essential. And I think the other part of World Clubfoot Day is also to encourage everybody to not only spread the word about clubfoot, that it's treatable, but to join us and support us in getting rid of this completely treatable birth defect as soon as we can as a child is born.
100%. And you just spoke about other.
So yeah, that's really what it's about.
Yeah,
Mm.
yeah, 100%. I get you. You just mentioned the importance of community, and that is other people also getting involved. You just
Yes.
or Steps just had a shoelace challenge, and that was in collaboration with the Czech Republic, if I'm saying it correctly. And
Yes.
people were capturing their shoelace challenges from across the world, if I'm correct. Can you tell us a bit more about that exciting challenge and what was the impact of that?
Well, it was the first time we'd done this, and we thought, let's get the public involved doing something fun and make it, you know, something that everybody can do and get involved in. And the reason that we did it with the Czech Republic, there's a parent-led organization called Achilles, and we are all part of a global consortium of clubfoot support organizations called Global Clubfoot Initiative. And we had a meeting about World Clubfoot Day, what everyone was doing, how do we spread the word? And they had this idea, and I immediately mailed it off and said, I love your idea, and we do it with you. So the two of had a shared campaign where we tagged each other. So we had people in Europe and in Africa, and in fact in other parts of the world also sharing. And the whole idea behind it, the message behind it was, try and tie your shoes together as tight as you can, and then try and see how many steps you can walk. Wow. And to kind of feel the feeling of immobility that a person's going to have if they're not born with, if they're born with a birth defect and it's not treated, and or incorrectly treated. And we had parents with who'd had their kids treated and were now running around who were doing it as well, and we had all kinds of people doing it. And I think it got the message through to people that this, immobility, as we all know, if you hurt your foot or you bang your knee, it's nothing worse than feeling immobile. And disability is a real and something that many people have to live with for all their lives. And the less resources you have, the more difficult it is. But this doesn't have to be a disability. And there is this message of hope that we can treat these children and they can grow up to lead very active lives. And this is the Shoelace Challenge. We haven't, the analytics of the campaign are still being together, but we got so much response. We really did. It was just people putting up videos. Our clinics took part. We've got 38 partner clinics in the state health sector. We had doctors and nurses doing it. We had kids, doing it at the clinic. Our clinic coordinators at work at the clinic were doing it. I also did it, embarrassing enough. I realized how badly coordinated I am. But yeah, it was just, I think, I hope, I hope that next year we're going to have a wrap-up meeting with a global group in about a month's time. And I really want to see if more countries will join us with it, on doing this next year, because it's a cool way for people to get involved and to share this message, that please let's just get the word out that clubfoot should be treated. And then as an add-on to the campaign, we had a way for people to get even more involved by signing up to give monthly 60 Rand, which doesn't sound like a lot of money. But if you count 60 Rand over 4 years, which is how long clubfoot treatment is, that's how much it costs steps to support one patient in our partner clinics. So if every 60 Rand monthly, nowadays with we're getting close to that for a cup of coffee and a fancy, cappuccino. It's not that much, but it actually makes a big impact in a child's life when you're giving that monthly. And imagine if 1,000 people are giving that every month, a 60 Rand a month. That's 1,000 children that are being supported to go into school, to go and get jobs, eventually get married, and just live without any shame or isolation, which is unfortunately what happens to people when they grow up looking different from other people.
100%. This is so intentional, Karen, and it goes a very long way. I mean, 60 Rand is something small for some of us, but it's huge for someone else. So lastly, what can we look forward to from steps onwards, since now we're in June going to July, which means we have 6 months left of 2023. So what can we look forward to?
Yes.
And how can people be involved as well?
Well, we're going to be partnering with a corporate in November for Disability Awareness Month, and it'll be a staff matching donation campaign, which I think will be amazing because we'll get the message out to more people and also obviously be able to support more children. We're also going to be training 75 health professionals over 3 workshops in the Ponseti method. The one is in areas where we've identified that we need assistance, and that'll be in the Eastern Rural Cape, in Tata, and Maritzburg for KZN, which is our second busiest province now. It's hugely busy. And then also in the Northern Cape, which is I believe, the size of Germany, and there's only 2 small clubfoot clinics there. So something that will be an outreach where we can empower and decentralize the treatment, because the kids don't have to travel 8 hours back and forth to the clinic, which obviously, especially as there's a high level of unemployment, those children may never reach treatment. So there's a lot of focus on that, and getting ready for our awareness campaign. And what's coming up next month is our 18th birthday. So we're gradually, becoming mature teenagers as an organization. It's because STEPS was founded in 2005. So next month is a month of celebration and gratitude to everybody that we work with, everyone that supported us, and a special shout out to the 40 children that are being supported by people who've already joined our Stepping Up campaign. In fact, I think it's more. That was the count about 2 weeks ago. So so we're busy. We're not going to slow down, heading up into the end of the year, and looking forward to hopefully chatting to you again, or sharing all of our stuff on social media, so you know what we're up to.
Yeah, that's fantastic. Congratulations on 18 years. That's huge. Lastly, how can people reach out, or like, how can people find STEPS on the socials? What are the handles?
Yes. And the social handles are STEPS South Africa or STEPS SA. That's the easiest way to find us. And we are on Instagram and Facebook, and obviously LinkedIn, and the others, but the Instagram and Facebook are the busiest ones. So if you look up STEPS South Africa or STEPS SA with an underscore after STEPS, you'll find us. I think actually, Facebook is STEPS SA, or you can just go to our website, and the links to the social media on there. Our website's www.steps.org.za. And even if you want to know something about Clubfoot, or you need some help, or you'd like to send us some money, or join Stepping Up, all the information is on the website, or just email us on info@steps.org.za, and one of us will get back to you. But thanks for asking that. Yeah, as we always said in the beginning, communication is key, isn't it?
Absolutely. It's what we do on a daily. Karen, thank you so much. Have a fantastic day. We appreciate it. Hope to talk to you soon, and keep up the good work.